Good day, aspiring nurses. I hope everyone is in good health. Welcome to your NCM 107 RLE, Maternal and Child Health Nursing among well clients. Our topic for this week is about the delivery room instrumentation. Let me ask you first, is knowing the different kinds of instrument used in the delivery room important, and why? I know you are thinking of different answers, and it's good that you have different ideas. Yes, as a nurse, it is very important to know what are the instruments and even equipments to be used in delivery room. Number one reason, it helps us to be acquainted on its parts and on how to use it. Second, it helps us to know their functions and when to use the instrument. Third, it aids us nurses to make the delivery process safe and efficient. Okay, moving on to the next slide. Here are the actual pictures of common delivery room instruments. I'll give you 20 seconds to observe its appearance when it comes to shape, parts, and purpose. Timer starts now. Okay, let's have a quick video look on the first set of delivery instruments. Let's have a quick video look on the second set of delivery instruments. You have witnessed the short videos of delivery room common instruments. Let's have their concepts to fully understand their functions and purposes. The first one is thumb forceps. Thumb forceps, referred to as smooth forceps or pickups. They are spring forceps used by compression between your thumb and forefinger and are used for grasping, holding, or manipulating body tissue. Tissues should be grasped and held in position so the obstetrician or the surgeon can perform the desired maneuver such as dissecting or suturing without injuring surrounding tissues. It is usually used in almost every medical discipline in the surgery, hospital, or operating room. The basic function of thumb forceps is to hold or move tissue during surgery or to move dressing. How to use thumb forceps and other instruments. Thumb forceps should be held between the thumb and index finger with a pencil grip when in use and in the palmed position when not in use. In this way of holding, you can ensure the safety and security of the instruments. Thumb forceps are tapered with serrations or groove at the tip. They will not injure delicate structures. The next DR instrument is tissue forceps, also referred to as tooth forceps. Tissue forceps are used in pairs to pick up or hold soft tissues and vessels. They have single tooth on one side that fits between two teeth on the opposing side or row of multiple teeth at the tip. The next instrument is the Mayo scissors. Mayo scissors is a type of surgical scissors often used in the cutting of fascia. Mayo scissors may be made from stainless steel or titanium. There are straight and curved blade varieties of Mayo scissors. Mayo scissors have semi-blunt ends, a feature that distinguishes them from most other surgical scissors. Metzenbaum scissors are, however, similar in that the ends are the same on both scissors halves, but its handle is longer and its middle section is slightly narrower. Straight-bladed Mayo scissors are designed for cutting body tissues near the surface of a wound. As straight-bladed Mayo scissors are also used for cutting sutures. They are also referred to as suture scissors. While curved-bladed Mayo scissors allow deeper penetration into the wound than the type with straight blades. The curved style of Mayo scissor is used to cut thick tissues such as those found in the uterus, muscles, breast, and foot. Mayo scissors are used for dissection and are placed in tissue with the tips closed. The scissors are then opened so that the tips open and spread out the tissue during the dissection process. Metzenbaum scissors are surgical scissors designed for cutting delicate tissue and blunt dissection. They are constructed of stainless steel and may have tungsten carbide cutting surface inserts. The blades can be curved or straight, and the most common type of scissors used in organ-related operations. Moving on to pian forceps. A pian forceps is a hemostat. It is also called a hemostatic clamp, arterial forceps, or pian after Jules Emile Pian. It is a surgical tool used in many surgical procedures to control bleeding. For this reason, it's common in the initial phases of surgery for initial incision to be lined with hemostats with which close blood vessels awaiting ligation. It is also used for clamping larger tissue and vessels for hemostasis. The full horizontal serrations and 12 lengths make these forceps a versatile instrument used in multiple procedures. It is curved with full horizontally serrated jaws and a length of 12 inches. Next is Alice forceps. An Alice forceps, also called the Alice clamps, is a commonly used surgical instrument. The Alice clamp is a surgical instrument with sharp teeth used to hold or grasp heavy tissue. It is also used to grasp fascia and soft tissues such as breast or bowel tissue. Alice clamps can cause damage, so they are often used in tissue about to be removed. When used to grasp the cervix to stabilize the uterus, such as when an intrauterine device is being inserted, an Alice clamp has the advantage of causing less bleeding than the more commonly used tenaculum. Needle holder. A needle holder, also called needle driver, is a surgical instrument similar to a hemostat. This is used by doctors and surgeons to hold a suturing needle for closing wounds during suturing and surgical procedures. Most needle holders also have a clamp mechanism that locks the needle in place, allowing the user to maneuver the needle through various tissues. Next is the ovum forceps. Ovum forceps are commonly used to properly remove pieces of placenta or products of conception from the uterus to prevent infection. The flat blades are serrated and hollow to firmly grasp the tissues to be removed. It is also used as a hemostat or a clamping instrument and used as gynecological instruments. It is also used as a hemostat or a clamping instrument and used as gynecological instruments since these deal with performing abortions if they may be required. Ovum forceps are available in those which can be locked and those which cannot be. Uterine sound. Uterine sounds are gynecological instruments which are used to examine the vaginal cavity and to measure the depth of the uterus and used for probing and dilating the uterus through the cervix. It is primarily used to measure the length of the cervical canal and uterus. Uterine sounds are inserted into the woman's uterus from the cervix so that the length of the uterus can be determined and to find out what direction the uterus and the cervical canal take so that it can be determined the amount of dilation which has already taken place and to even further the dilation to the amount which is required. Uterine sounds are commonly used before the insertion of intrauterine device and removal of intrauterine devices. The last DR instrument that we are going to tackle is obstetrical forceps. Obstetrical forceps are instruments that can be used to assist in the delivery of a baby as an alternative to vacuum extraction method. It should only be undertaken to help promote the health of the mother or the baby. Obstetrical forceps are instruments designed to aid in the delivery of the fetus by applying traction to the fetal head. Many different types of forceps have been described and developed. Generally, forceps consist of two mirror image metal instruments that are maneuvered to cradle the fetal head and are articulated, after which traction is applied to effect delivery. Advantages of forceps use include avoidance of cesarean section, reduction of delivery time, and general applicability with cephalic presentation. That ends our lesson on instrumentation. Thank you for listening and God bless everyone.